Well, we'd like to welcome you all to Heart Smart. This is a brand new segment we're starting here on WTOC with Dr. Roy Flood. Each month we'll be talking about a different question that he sees often in his practice about heart health and how to live a healthier life. We are joined once again by Dr. Roy Flood. I'd like to thank you for being part of this show here on WTOC. Since this is our first episode, I guess before we jump into today's topic, Dr. Flood, just tell me a little bit about yourself and your practice.
Jude, first of all, I'm excited. I'm glad to be here. Appreciate the opportunity to talk about something I know and love dearly. I am a interventional cardiologist. I work out of SouthCoast Health on Eisenhower. I spend a lot of my time doing what we're doing now, talking to patients, and I also have a procedural side to my job. So kind of a mix of clinical discussions, procedures, all the things that make cardiology fun. So I'm hoping we'll get to go into some good topics today.
Absolutely, and we appreciate your expertise. Today's topic is something that's near and dear to my heart, energy drinks. I guess first off, obviously, you see the name, you see the branding, energy drink. They're obviously marketed to give you energy. But when you pop open one of these in the morning, what is an energy drink and what does it actually do to your body?
Well, they are often mega doses of caffeine. If you can think of a hyper cup of coffee, so to speak, that's the amount of caffeine, and that's what makes them so appealing to so many people. A lot of people find the energy drinks are cooler, sometimes taste better, and are definitely a more of a in the know thing for certain demographics. So I find that in my practice, a lot of my younger patients, a lot of the teenagers and the people we run into really like the energy drinks. They would much prefer that over a cup of coffee in the morning and all day long.
Yeah, I haven't been shy about my my energy drink usage. I'm sometimes a 2 energy drink a day kind of guy. I don't know if that's good or bad. I guess we'll get into that in a little bit. But Dr. Flood, why are there potential cardiac concerns around these drinks?
Well, despite all the things we just said, they can be dangerous. And so really, I think the whole premise of our discussion today is just to alert, inform, educate. Not to say, Jude, put away your drink, but I want you to know what it can potentially do. So all of them usually have a significant amount of caffeine. So what caffeine does is raise heart rate, raise blood pressure, increase the contractility, the pumping ability of the heart. So those are all the things that kind of get you up and going, but also things that can be harmful. And what's most concerning about energy drinks is the ability to change or alter the heart rhythm. And that's where they can be potentially problematic.
I see. Why would an alterated heart rhythm or an elevated heart rate be a potential concern for somebody?
Well, it can be fatal, okay? Most of the time, not, of course. But in people who have certain predilections, people who may just drink too many or too much, these energy drinks and that big bolus of caffeine and taurine and guarana, all the things that are commonly found in these drinks can really get the heart revved up in a way that it's not accustomed to doing. And that can lead into dangerously fast heart rhythms. And it can also tip people who have some underlying conditions, can bring these conditions to light in not a good way. So there are case reports of people having loss of consciousness, abnormal rhythms, death, heart attacks. All these things are associated. Now, these are things that are on the fringe. It's not happening every time you pop open drink of whatever your drink of choice is, but I want people to be aware that that potential is there. And I became interested in this because I was seeing so many people that I thought couldn't have any heart problems, that young people 15 to 20 that were coming in and talking about, I feel my heart beating funny, or I feel a racing sensation. I don't know what that's about. and you start talking to them, they may pop a couple in the morning, then later at night, and they're using it for study aids or to stay awake at work, for a variety of reasons. And a lot of people just like the way they taste, so they drink them.
And, if there's someone out there, these are all over the place,
Sure.
Every single gas station. Are there any certain, conditions or types of folks who should maybe think twice before drinking one of these?
Sure. I guess the people that first come to my mind are those persons with underlying cardiac conditions. And there are recommendations, really should not have more than 200 milligrams of caffeine per day. So that's about a cup and a half, depending on who's making the coffee. So those people, or the coffee or the energy drink, I should say, those people should be aware. Pregnant women, because they not only can affect their heart, but also affect the heart of the unborn baby. They are not recommended for children under the age of 12. So that's another area of concern. Adults, usually 400 milligrams or so. So that would be the equivalent of 3 cups of coffee. And these are considered the average recommendations. Really shouldn't go too much over that amount in order to keep your risk, pretty low.
Gotcha. So 400 is kind of a good bar to base yourself for a healthy, normal adult.
Sure. Correct.
Okay.
Correct.
Well, I appreciate you, and I have some props, Dr. Flood. I appreciate you mentioning...
We don't have to drink those now, do we? No.
If you'd like to.
No.
One of the things I appreciate you mentioning is that you said kids under 12 shouldn't have these, because one of the things I've noticed a lot recently, there's a lot of newer energy drinks on the market, and this one's a Hawaiian Punch flavor.
Okay.
I've seen flavors like that. I've seen a lot of candy type flavors too. I saw Jolly Ranchers and Skittles flavors energy drinks. And a lot of parents might see something like this and see, oh, it's a candy drink. That means my kid can have it. But you're saying 12 and under, stay away from these.
Stay away from them. And let's remind ourselves that the companies that make these are targeting younger population, teens, young adults. I mean, they're cool, much cooler than a cup of coffee with some cream in it. And when you see the advertisements, the billboards, and it's usually someone who's in great shape, they're athletic, they are touted to boost our creativity, give us energy, all things that we think are good, and in many ways are good, but these can be dangerous.
Yeah. And we do have a couple different ones here. I've noticed that, looking at caffeine content, we've got one that has 80 milligrams, one that has 200 milligrams. I think this one has 160. Are all energy drinks the same, or are there potential different risks when it comes to...
Well, there are different risks, and those risks you've just touched upon. It really depends on how much of the caffeine and the other ingredients are in the can. So really, this is a case where it's very important to read the labels and remember that the labeling may be somewhat misleading. Because typically if you have a 16-ounce drink, it may be touted as the amount of caffeine that's in an 8-ounce drink. So you may be getting double the dose if you take a quick glance at the label and don't put all the pieces together that you really have in a large drink, so you can get double the dose of caffeine. And in addition to the caffeine and taurine, et cetera, a lot of sugar in the drinks, and that's not necessarily the best thing from a cardiac perspective either.
Absolutely.
So they should be used with caution.
Yeah. And what are some steps to maybe reduce risk, reduce your chances of having to, go in and see a doctor if you are drinking these regularly?
Just keep an eye on how many you're drinking, how often you're drinking. Kind of keep that total number in the back of your mind. And if you have any of the underlying conditions that we talked about, underlying cardiac problems, if you are pregnant, wouldn't count for you.
Yeah.
If you're in a certain age range, if you're very young, you just need to be very careful with them. And then also, if you are drinking other things or have other things in your diet that would be additive upon this, then it's good to know about it.
That's a good point, too, because there's caffeine in so many different things. Even just regular soda, if you're drinking a couple different Coca-Colas, you can probably get to...
Yeah, so let's talk about that for a minute. You picked up one of them. I guess that looks like the Red Bull that has maybe 80 or so. Yeah. So Coke and Pepsi tend to have around 30, 35 milligrams. This has 80 or so there. And I think the Monster has a little more than that. If you...
Yeah, this is 160 per can.
Okay, so that gives you an idea. So you would need to drink 5 Cokes to have what you have in that Monster.
All right. Well, finally, Dr. Flood, just, for your patients who come in, what are your general recommendations when it comes to energy drinks?
Use with caution. Use with caution. I don't think that as a physician, my job is necessarily to be overly judgmental, but I think it is my job to make sure that you are informed and you're making the best informed decisions for yourself based on good, solid information of the pros and cons of what you're doing.
Awesome. Well, I appreciate your advice. I think that was really insightful. Before we sign off today, anything else you'd like to bring up when it comes to the topic of energy drinks?
Yeah, I'm glad you said that, and I hadn't thought about this until just now. A lot of my younger patients will sometimes lace these drinks with alcohol. Okay. So that's something else that adds to the risks of the drinks. So just be cautious when you make your choices.
Wonderful. Well, Dr. Flood, we appreciate your time today. That's going to wrap things up for this first episode of Heart Smart with Dr. Flood. We'll be back next month to talk about heart supplements, I believe. So stay tuned for that. Looking forward to that conversation.
We will not mix the supplements and the energy drink talk.
That's true. Okay. Well, until next time, we'd like to thank you all for watching.